In a nation where the average American's favorite cardio is scrolling through DoorDash, the Make America Healthy Again movement is a necessary endeavor. It aims to tackle the great American pastimes of food addiction and sedentary bliss, all of which have helped us clinch our world-class obesity and overdose rates. With the latest CDC data showing 42.4% of American adults qualifying as obese, it seems MAHA has its work cut out for it. MAHA isn't just about forcing kale into unsuspecting burgers. It's about promoting healthier lifestyles through personal responsibility, better public policy, and the lost art of moving one's legs. Advocates of the movement want to see a reinvigoration of physical activity, nutrition education, and they want to make sure that big food and their special interests are put in check. These are the overlords who snuck high fructose corn syrup into everything from ketchup to healthy yogurt. They also aim to reduce dependence on prescription drugs by encouraging preventative health measures rather than just tossing pills at every problem like a pharmaceutical slot machine. RFK Jr., having battled addiction himself, gets it. He's pushing wellness farms for addicts. Think fresh air and nature and purpose over methadone lines and pharmaceutical cocktails. With 22.1 million Americans struggling with substance abuse, RFK's lived experience fuels a very sharp, savvy take on how we can get this country clean. The reality is grim. When it comes to our health, look, the American Diabetes Association is reporting that 37.3 million Americans have diabetes, with another 96 million adults in pre-diabetes limbo. Heart disease remains the #1 killer, and a sedentary lifestyle is now linked to nearly half of the increase in early mortality. MAHA isn't about vanity, it's about survival. Unless Americans start making different choices, we are one generation away from breaking the Guinness World Record for the largest collective muffin top. Joining us now, founder of Mothers Against Drug Addiction and Deaths, Jacqui Berlinn, and health freedom advocate and Primal health coach, Mia Hansen. I'll start with you, Mia. Why are so many Americans right now overweight and depressed?
Well, really, one thing that I think it comes down to is our diet. Obesity is a food addiction, and junk food acts as a dopamine stimulant just as addictive substances do. Food addiction is certainly common in America, with more than 40% of adults being obese, and that's 2 in 5 people. Obesity rates have tripled since the 60s, and that's not surprising. Ultra-processed foods are designed to be addictive, and they are hyper-palatable yet not satiating. So less people today are getting whole foods from local farms because convenience has taken the forefront in our society. So I believe it's just kind of inevitable for most people that are not educated on the subject.
And I would also say, Jacqui, it's not just the addiction to food, it's the addiction to so many drugs that oftentimes is facilitated by the big pharma choices and the big pharma pushing of certain things that get people really hooked. Where do you think America stands right now in our battle against addiction?
I think we need to make some major changes. We definitely are losing. It's a losing battle. Addiction is one of our country's deadliest problems, and I'm only seeing it get worse. I do a lot of work in San Francisco, and they've poured billions of dollars into this issue, and there's been no improvement. It's actually seems to have gotten worse. We don't have the ability to place people even when they ask to get into recovery. There is not the recovery and treatment facilities available for them or people to staff them. So I believe that we really need to have an ongoing dialogue with a willingness to start innovating to bring the health back to these Americans that have been struggling with mental illness and addiction. And unfortunately, I think it's only going to get worse with this generation that has been using phones and not eating well. And I just think it's going to cause a huge mental illness crisis in the United States. And we need to get ahead of this and be prepared.
Mia, I saw you nodding along to that, but I was hopeful that so many of the Zoomers were looking at the labels and ingredients, and a lot of the millennial moms really organized around the Make America Healthy Again movement. What fuels your pessimism in this next generation's ability to break some of these unhealthy cycles?
Well, I do feel like people are realizing that diet plays a role. One of the surest ways to heal the mind is to heal the body first, and our gut alone plays a role in our mental health, hence why the GAPS diet, which is the gut and psychology syndrome diet by Dr. Natasha Campbell McBride, has been successful in treating ADHD, ADD, depression, schizophrenia, and many more mental conditions where most patients don't know that they have other options than to be dependent on a drug for the rest of their lives. I feel like it's time we let options like this be known and to put an end to countless sufferers' cycles of addiction and dependency.
Jacqui, you mentioned innovation being a way to break through some of our prior failures. We've seen RFK Jr. talk about wellness farms as a concept to connect people with nature and try something different. Are you familiar with this, and what do you think about the Health Secretary's plan to implement it?
I am familiar with this, and I love that he is thinking of other ideas or looking back at some things that have really worked well. I absolutely do believe that in healthy eating, being with community, a sense of belonging, as well as being outside and working in nature and getting away from technology is absolutely healthy for your mind, body, and spirit. It's a holistic way of looking at healing someone who's an addict, who's been struggling with mental illness and drug addiction. I do also see, though, that it needs to be part of a continuum of care. Unfortunately, fentanyl has come along and it's made things extremely difficult for some addicts to get off without having medically assisted treatment. And I do believe the goal is to eventually have that clean living, to be free of these drugs. But I think when an addict first comes in, especially if it's a fentanyl addict, comes in for help, they do need to go through a detox period, and medically assisted treatment can help them stay and continue and focus to get well. Whereas some people can just give up hope if they don't have that treatment, because fentanyl is such a horrific drug to try to get off of without any kind of help.
Sure, and I have seen in my home state of Florida the rehab shuffle, where people get moved from one element of care to another, and it's not really a continuum. It's just a way to keep bilking the taxpayer while keeping people addicted, and that's what we hope through Secretary Kennedy's own experience with addiction, that he can help break through. Now, Mia, you talked about the need to have more of this individual empowerment and to get away from the things that give us those dopamine hits. Oftentimes, the special interests around big food, they stop legislation that would empower those consumers. What are the changes that you're looking forward to in this administration that might give people the ability to fight back against this biological war that seems to be waged against us as Americans?
Well, one of the biggest things that I've noticed is the past FDA failures that have heavily contributed to the addiction crisis due to these regulatory mistakes on, for example, pharmaceutical companies that have deceptively promoted opioids. We're looking at these inexcusable increases in prescribing, in opioid use disorder, and in deaths by overdose, because we shouldn't just, basically right now, we are just as likely to leave a doctor's office with an addiction as we are to leave an open air drug market with one. We're seeing false marketing claims by opioid manufacturers. We're seeing a lack of adequate and well-controlled clinical trials for opioids. We're seeing poor management of the conflicts of interest between the FDA staff and industry. And it's like a revolving door where 20% of employees will leave the FDA to go work for the very industry they were regulating. So it seems that they have all of these ulterior motives within the FDA, as opposed to actually making our country healthy and regulating our food system, taking out less seed oils, artificial sweeteners, artificial foods, things that are making food hyper palatable, as opposed to just what they're doing now, which is focusing on their own profits.
Clip that and tag Robert F. Kennedy Jr. That is exactly what has happened. It has been regulatory capture, and then we just end up as a sicker and more addicted society as a result. But that you perfectly described how we end up in that situation. And Jacqui, I've only got a few seconds left, but I want you to be able to make the pitch for your organization, Mothers Against Drug Addiction and Death. How can folks be involved and maybe get connected to services if there's someone they're concerned about in their circle of friends and loved ones?
Absolutely. They can reach out to me or some of my partners at www.MADAAD.org, and we would be happy to connect with them and give them some guidance, and even if they just need a friend to talk to about what they're going through with their addicted loved one.
Oh, well, Mia Hansen and Jacqui Berlinn, thank you so much for what you do and for joining the program to share your perspective.
Thank you for having us.